tripling of the cases of verbal and physical assault on our healthcare workers.
Dr. Mohawk DeVays, chief of emergency at Northeastern Georgia Medical, says the stress from COVID is bubbling over. He attributes multiple factors to the rise: overworked staff, strained resources to care for patients, COVID rules over masks, and visitation limits.
And you've got to tell those family members you need to wait outside. We need to get this patient stabilized. And that's really, really hard for those families, and that makes them upset.
The phenomenon nationwide. In Missouri, Cox Medical Center resorting to giving staffers panic buttons, reporting patients spitting, yelling, and beating workers. Assaults, they say, jumped from 40 to 123 between 2019 and 2020.
We have the chance to press our button, and then security knows exactly where we are. And if we end up having to chase a patient down, they know where our last location is.
It comes as hospitals struggle to keep medical workers on the job, with many facing severe nursing shortages.
They're exhausted. There's fewer and fewer people that feel that they can bear the risk to come to work. The risk of being exposed to COVID, the risk of verbal, physical, sexual assault. Those are real risks to a lot of folks.
Hospital groups and unions now asking states to step in, calling for increased penalties for those who assault medical staff.
Like so many things in our society, laws do have to change to ultimately change behaviors over time.
The nightmare for many healthcare workers extends beyond the walls of the hospital they work in. Folks who work in the hospital behind me telling us that some of them are taking their badges off before they go shopping in the evening. They don't want folks to know what it is they do for a living.